Hello, everyone. Thank you for having us here at the 2022 IOHSK International Conference. We are here representing California State University, San Bernardino, Department of Kinesiology. My name is Kyle Moore, and I am a senior here at Cal State San Bernardino.
Hello, everyone. My name is Elias Sariola, and I'm a junior here at California State University, San Bernardino.
Hello, my name is Adrian Gomez, and I'm a senior at California State University, San Bernardino.
Today, we are presenting a research critique on sports injury type and psychological factors that affect treatment period and willingness to pay. This study illustrates the sports injuries and symptoms of Korean elite collegiate athletes. It also shows the influence of career length, past injuries, and individual fears for injuries on the treatment period and their willingness to pay. Elite athletes tend to have higher risk for trauma, as well as higher incidence of overuse injury compared to leisure sport athletes, which results in their long-term health being compromised. Psychological factors such as distress and anxiety also play a huge role in these athletes' rehabilitation time and their timetable to return to play. Considering these aspects, both short and long-term sports injuries affect the athlete's condition, as well as their long-term physical and psychological health. With proper and effective approaches to injury prevention, treatment, and rehabilitation, the athlete's needs and their long-term health could be easily met. The objective or the purpose of this study was to describe the common type of sports injuries in elite collegiate athletes, as well as to examine their influence of career length, past injuries, and psychological factors on the treatment period and the athlete's willingness to pay for the treatment.
For the methods of this case study, they conducted a survey of elite athletes in different sports competing at the national or international level among students currently enrolled in the PE department at Korean National Sport University in the fall semester of 2017. They have the largest number of elite athletes at those levels, with a total of 728 students. Before participation in the study, they obtained written informed consent and ensured participants that all responses would be confidential. To conduct this survey, a researcher visited classes or training sessions to provide instructions and questionnaires. They sent an open-ended questionnaire to categorize them by sports disciplines and injury location. In the structured, forced, multiple, or binary choice survey, participants were asked about location and types of injury. The human body was divided into 16 parts, and the types of injuries were divided into 8 types. The treatment period and psychological factors were also recorded. The most severe and common injuries by discipline were analyzed. The most common injuries, according to the sports discipline, were visualized on a diagram of the human body, and the frequency with which the body parts were mentioned as the most commonly injured areas were expressed using a color spectrum.
Following with the results, among 728 athletes that were registered in the Department of Physical Education for the Korean Sport and Olympic Committee, 624 students, which roughly around 86% of students, out of the total responded to the survey within those 23 sports. Of the survey conducted, 30% of athletes were female, and the largest group among the 23 sports tested on was track and field, which was about 12%. The largest group career-wise was in the range of 6 to 8 years professionally. A summed up overview of the injured areas severely and common areas are shown on Figure 1. Now, looking at Figure 1, it is a diagram of the human body. The sections show the most commonly injured areas and identify them by the participants. The color of the areas show the ratio percentage of the injuries in each area. The labeling of each area shows the sports discipline that was reported to cause the injury in that area. A was the anterior view of the body, and as you can see, B is the posterior view of the body. More than half of the respondents, 56%, had experienced sports injuries in the past year, which included weightlifting, track and field, fencing, and bowling, which had the highest 12-month prevalence of injury. This study hypothesized that the injured areas would vary according to sports disciplines and the results shown for the specific areas of the injury. The most frequent injured areas in the area of concern is most discipline included in the knee, ankle, back, and shoulders. The specific areas commonly injured in specific sports, including wrist and bowling, the most frequent severe injuries was also involved in the hand for boxing and in the wrist of golf. The most frequent area of concern for injuries was during the treatment period and the WTP for sports injuries. They all vary according to the sports disciplines, past injuries, and psychological factors related to further injuries. The results show that the treatment period was indeed influenced by the sports discipline, career length, location, types of injuries, and fears for the injuries. In addition, WTP was influenced by individual fears for the injuries, especially participants who were highly aware of injuries in frequently used areas that were willing to pay higher for treatment and the rehabilitation period. Now, the most frequently mentioned for concerns of injury were, like I said, in the wrists of bowling and in the hands of boxing and the feet of taekwondo. Treatment period was the time taken for the treatment of the most severe and common injuries. Athletes with longer careers, which was around 16 to 18 years, had longer treatment periods compared to the athletes that had short careers. There were no major distinctions between male and female athletes willing to pay, while career length did not matter in this study. WTP was high, however, regarding psychological fears of injuries in those areas. Now, according to sports disciplines, judo, track and field, weightlifting, and fencing had the highest 12-month prevalence period. And also with the demographic factors, including fear of injuries, were also included in this treatment.
This study illustrates the injuries and symptoms of Korean elite college athletes, as well as the influence of career length, past injuries, and individual fears for injuries during the treatment period and WTP. Recent studies have shown there are many gaps in our current knowledge of athlete pain management, and that further information and studies are required. This study suggests a specialized approach in training, as well as in treatment and rehabilitation, is required based on the discipline and career length. It also implicates the importance of psychological supports to athletes during rehabilitation and training to overcome their fears. Some of the limitations of this study were that although they were able to get a lot of participants, the variety of sports disciplines was not as diverse due to the time the survey was conducted. For example, they were unable to get winter sports such as snowboarding, skiing, and figure skating, since the athletes were in training camps to prepare for the Winter Olympics. Finding a time between both the Olympics and Winter Olympics could help conduct the survey better to have the availability and accessibility of all athletes. Another limitation was that certain sports were categorized into one category due to the limited number of athletes in those sports disciplines. This article did a great job in collecting a variety of relevant data for this study, such as the athlete's age, the sex, and sports disciplines. One thing that could have been considered and included in this study is whether gender variable played a role, which could answer some interesting questions. Were male or female athletes more prone to getting injured? Which gender tended to have the more serious injuries? And was there a difference in gender and their willingness to pay for treatment? That is everything we have on our presentation. Thank you for coming.